A disability is something that has a major impact on your life.
Every disability is different.
And it's never the same thing for two people. I am blind in my right eye totally and partially sighted in my left eye.
I was 18 years old. We were traveling way too fast on a gravel road. Broke my neck, my back.
My Asperger's syndrome and my cerebral palsy.
I have anxiety and depression. People would have no idea just talking to me.
Being independent means different things to different people.
I want to live in my own house. I want to pay my own bills.
Live independently and not rely on other people.
When someone is not able to live as independently as they can, it does have a detrimental effect on people's physical and mental well-being.
It's no complicated thing. It's just that people with disabilities want to be included.
Plenty of people get stuck in ruts when they feel like they can't overcome something in their life. That's where Lyft comes in.
Living independently for today and tomorrow. Lyft. We help people of all ages and all types of disabilities find the resources or acquire the skills to live as independently as possible.
We serve the southeastern 18 counties here at the Billings office. We have a variety of things that we offer. We can help with grant funding for adaptive equipment.
Maybe a home modification so they're able to access their home. We help people to find that funding.
Helping people apply for Social Security benefits.
Medicaid, Medicare, housing.
They have a peer support group. Peer support, I think, is key.
Sharing life experiences is one of the most powerful things to help people who might be new to disability, who might be struggling with their disability.
Youth transitions is kids that are transitioning out of high school. They need to learn those adulting skills. It might be rent an apartment, learn how to grocery shop, budgeting.
Help someone advocate for themselves in a school or an employment setting. One of our biggest strengths is providing folks with information and referral. If we can't help you, we hope to know who can.
A lot of times we'll have a potential consumer call in and they think that they just have one need, and it turns out that we end up finding 3 or 4 things we can actually do for them.
You can just come in and say, hey, I feel like I have this going on. Can you help me? And we can, which is so cool to me. I love that.
Most of us on staff at Lyft have identified ourselves as having one or more disabilities. That is helpful in many cases.
It's easier to empathize with someone when you yourself have struggled with a disability.
This is what we specialize in. This is who we are, and this is what we do.
And it costs nothing to go to Lyft. It's a nonprofit organization and they're there to help.
Somebody that was a consumer that was working with Lyft was asked to do an art project. He visualized that the balloon helps to lift people up. And then it became the logo, and it's stuck.
There's been success on all kinds of levels.
It's really rewarding to have a consumer go, hey, I was able to do this by myself today.
We want people to live their best life as independent as possible.
Live as everyone else in society and live as a part of society, not apart from society.
Everybody needs help. Sometimes you just need a little more help, and that's okay. That's absolutely okay.
There's plenty of life to live still, and there's a way you can do it. Keep chipping away at it, little by little by little.
Knowledge is power. Let's share it, for crying out loud.
Send us an email, give us a call. We'll do our best to help.
We can definitely help figure out what your needs are and get started on that. We're one of many steps in the path to independence, and we're happy to be serving people here in the community.
Good day and welcome to Living Well in Montana. Living Well in Montana is a program of living independently for today and tomorrow. LIFT, L-I-F-T-T, as we often style ourselves. LIFT is what is known as a Center for Independent Living, meaning that we are a hub for advocacy, resources, and programs that help and aid people with disabilities in living the lives that they want as independent members of their communities in their own homes, as opposed to being institutionalized. For more information about LIFT, I encourage you to visit our website at lift.org or give us a call. Our office in Billings, again, we serve 18 counties in southeastern and south central Montana with 2 offices. Our office in Billings can be reached at 406-259-5181, and our office in Glendive can be reached at 406-948-8500. Today on the program, we'll be returning to a subject that we covered in November, but it's important enough that we wanted to bring it around again a little quicker than sometimes we often do. And that subject is the Money Follows the Person program. And today we have with us April Staudinger. Mm-hmm. And April is the project director for Money Follows the Person with the Department of Public Health and Human Services, the state of Montana. April, welcome.
Thank you. Thank you for having me today.
We'll start, sort of at the beginning. What exactly is Money Follows the Person?
Money Follows the Person is a federal demonstration project through the Centers for Medicare and Medicaid Services. It is the longest running demonstration grant in the history of Medicaid. It was implemented around 2005. And it has been a program here in Montana since 2014.
Right, and the Centers for Independent Living were involved in the advocacy to encourage Montana to write for the demonstration program. And when you say a demonstration program, what does that mean?
So it's not a permanent program through the federal government. What they typically do is they will start a project and have states demonstrate why it should become a permanent program. We're not quite sure. MFP is usually on the docket for congressional approval of permanency. It just hasn't happened, and we're not quite sure. Currently, the program is authorized through September of 2027, okay. And we've not heard any ideas or any indication from Congress what they're going to do, if they're going to reauthorize it or not.
Yeah, that seems to be a long time in congressional time these days, doesn't it? Even though it's coming up to those of us who are involved. So we have the sort of the technical that it is a demonstration program through the Center for Medicaid Services. What exactly does the program do, I guess, is the...
So we help Medicaid recipients who are living in institutional settings. Typically, right now, that usually entails sometimes hospitals, but mostly skilled nursing facilities. Sometimes when the state hospital is a Medicaid provider, they regain their certification. There are billable age ranges from the state hospital that could be eligible for MFP services. One of the eligibility criteria is that somebody has to have lived in that institutional setting for at least 60 consecutive days, and that Medicaid has to pay for at least one of those days. So that's why currently with the state hospital not being a Medicaid provider, that doesn't typically work. But if somebody makes a decision, makes a choice that they would rather live in the community than in, let's just say, a skilled nursing facility, they can contact us or referrals are made on their behalf. And then we reach out. We have a process. We have a lot of our new transition coordinators, which is a huge benefit of our program, is a person that kind of navigates the entire transition process. But a lot of our new transition coordinators are through the independent living centers in Montana, which has been just fabulous.
Right, and that's the part of the program that LIFT's involved in.
Yes, yes.
So it, so again, it moves folks who want to be moved out of institutional settings to into the community with the help of these transition coordinators. So you mentioned requirements. What are some of the requirements to be eligible for?
So the two criteria that I had just mentioned, also a person has to be willing to move into what's called an approved MFP setting. That's usually an apartment or a home owned by or rented by the participant or their family member. A community living situation like a group home, but that has to have four, can't have more than four.
The Medicaid community setting rule.
Yeah, and then the last one, which is pretty surprising to most people, are assisted living facilities. That's considered community living for money follows the person criteria. There are certain criteria that the facility has to adhere to, such as they have to allow the person to have access and lockable access and egress. They have to have access to their own separate living area, bathing area, sleeping area. The facility cannot require them to check in when they're leaving, when they're coming and going. We treat it like it's a regular apartment, so that's how it's considered community living. And that is pretty much it for eligibility criteria. Oh, excuse me. They do have to also be eligible for one of Montana's waiver programs.
Right, and those are like the developmental disability waiver and the senior long-term care waiver, and again, those
the severely disabling mentally ill waiver as well.
Right. Okay. And again, those waiver programs are part of Medicaid. And so a person is eligible for Medicaid, and then beyond that may be eligible for one of those waiver programs. And the waiver programs are also designed to help maintain home and community-based services, correct?
Yes.
All right.
The other thing I wanted to mention too is for the Big Sky waiver, which is the waiver that is for people who are either elderly or disabled.
Right.
They typically have a wait list for people to receive the waiver services. Anybody that's enrolled in or participating with Money Follows the Person gets to bypass that wait list. So we can move people out of that institutional setting faster than if they had to sit on the wait list.
Had to wait.
Yeah.
Okay, that's good to know that Money Follows the Person. And again, Money Follows the Person comes with some other benefits for the what we would at LIFT call a consumer. The participant, the program participant, I don't know what you would call it exactly. And maybe you could elaborate on what some of those benefits, like, having the transition coordinator, for instance?
Having a transition coordinator is a huge asset for the whole process in itself, because that person will work with all of the people involved. They work with the individual to set up, who do you want to be on your transition team? Do you want family members? Do you want the discharge planner from the nursing facility? Do you want any of your doctors? Whoever that person wants to be on their transition team, that transition coordinator kind of reaches out and says, hey, we're getting ready to move, Sally back into the community. She'd like you to participate on her transition team. They also work with the participant to say, what do you need to be successful in the community? You've been, however long that person's been living in a nursing home, they might need household goods. I don't have anything to set up my household. We can help them to purchase those types of items to help them move in. We've had people that need beds. How do you move into an apartment if you don't have the means to purchase all of that stuff? The household goods,
So there's a budget set aside for transitions.
Yes.
Okay.
Yes.
That's good to know. So I guess the next logical question is, how many people has Montana transitioned over the years? And I know that number has picked up since the centers have become involved. But
yes. So last year, since 2014, it's been about 350 people.
Okay.
And that really kind of died down a little bit around 2018 because it looked like they weren't going to reauthorize the demonstration project. And then in 2023, our leadership said, hey, they're going to continue the program.
Right.
Let's fully staff Montana's MFP program.
Okay.
So they did. They hired 4 of us in 2023, and we've just kind of taken off from there. Last year in 2025, we had projected to help 47 people move back into the community, and we were able to help 62.
Okay.
So that's that was also the year that we really expanded who our transition coordinators were, and the centers came aboard, and that help has just helped increased our transitions by leaps and bounds.
Okay. So again, sort of, the person transitions. Is there sort of follow-up, sort of post-transition assistance available through MFP?
So once they transition, they become enrolled in the waiver program.
Right.
So waiver pretty much takes care of whatever services that they need.
Okay.
If there is by chance something that comes along the way that an individual will need, and let's take example, not too long ago we had a person who was benefiting from a specialized recumbent bike. And the physical therapist said, hey, if this person doesn't have this on a daily basis, they're going to end up being reinstitutionalized simply because they can't maintain their mobility enough without that. And it was quite spendy. So the waiver team said, hey, this isn't something that Medicaid's going to cover. Can MFP pay for this? And because it was something that helped to keep that person from being reinstitutionalized, we were able to purchase that for her. So there are things that come along the way that MFP can help with, but we monitor that person for 365 days to make sure that they don't fall through those cracks.
Okay, so there's a 300-year process of monitoring by MFP after the person transitions in the community.
Yes.
And obviously there are unforeseen circumstances and whatnot that lead to reinstitutionalization, but would you say there's a pretty good rate of, once people are back in the community, they stay in the community?
Yeah, there are. Sometimes there are just things that happen along the way that a person has to go back into a nursing home for a while. But the good thing with MFP is, if, let's just say that they've been in the community for 100 days, and something happens, they fall and they break a hip and they have to go back into a nursing home for rehabilitation, we kind of put a place mark in that time frame for them. So when they're ready to come back out, we just pick up on day 101.
Okay.
So then they're good for, they don't have to go through any more eligibility criteria or any of that. red tape, and then they're good for the 365 days.
And again, on top of the what from the perspective of a Center for Independent Living would be the moral or ethical, or however you like to phrase it, sort of imperative of people being able to live as independently as possible in their homes and communities of their choice, as opposed to being warehoused in an institution. There's an economic factor to this, that because institutions, brick and mortar and employees cost money, and again if done right, and there's a lot of ifs and thens and what ifs involved, but again, it's been found that care in a home setting, in the community, where again the person is using community resources for things that oftentimes institutions have to provide, such as they're able to go to church, they don't need a chaplain, stuff like that.
Right.
It means that more money is spent on the care and less sort of on the overhead. Is that what you found?
Yes. So, and it's interesting that you bring that up, because we were just doing our annual budgeting to look at what those costs were, the cost savings were in 2025. And we transitioned, of those 62 people, we transitioned 51 into assisted living facilities. So we took the cost, the daily rate of an assisted living facility versus the daily rate of a skilled nursing facility.
Right.
And by not providing care in that skilled nursing facility, in 2025, Money Follows the Person saved the state $2.9 million. So that's $2.9 million the state did not have to spend on institutional care.
Right. Okay. So
it's very significant.
Yeah, that's in these budget conscious days, that is very important. I guess so. Has there been much work years and years ago when we were encouraging Montana to write for MFP, and I remember seeing these charts from North Dakota, and they were I think they were consumer surveys, but I'm not entirely sure. I probably have them on the computer somewhere if I looked hard enough, but and they talked about the human outcomes of the program. Is there, and that by and large, people were happier and healthier and more engaged in life and more has there been any sort of similar sense in Montana?
Yes. So I think what you're talking about is the quality of life survey that used to be mandatory for participants to partake in. I don't want to say participate in, but CMS ended that some years ago, but we started last year providing a survey at the end of, so after about 30 days after the person has moved back into the community, the transition coordinator meets with them again and goes through the survey and asks them the questions. What are the things that MFP was able to help you with that would not have made this transition possible? How are things going in these 30 days? I think the quality of life surveys would go maybe a little bit further than that 30 days. They would go like 60 or 90 days. But we kind of don't do surveys in that time frame, but we keep tabs on how people are doing. And periodically we are able to reach out to them to find out past that 30th day post-transition, how they're doing. And people are thrilled. The consensus really is, wow, I didn't know that I didn't have to live in the nursing home. You know, a lot of people, when they get to that point in their life, they think, oh, this is it. This is where I'm going to live for the rest of my life. And then once they realize that they don't have to, it's a game changer for a lot of people. And that's not to say that, you know, everybody, we've had people that say, no, thank you. I don't want to live in the community. They take care of me here. They monitor my medication for me. And so there are those people that,
Again, right. And that's another thing to point out, that whatever the choice made, the choice should be that of the individual.
Exactly.
In consultation with whomever they choose.
Yep.
All right. So if somebody is watching this on TV or on the internet and is interested in Money Follows the Person for themselves or for a friend, family member, what's the first step they take? Who do they contact?
They can go to our website, which is, let's see.
Often with the state website, the easiest way is to Google the name of the program and then Montana. Google Money Follows the Person and then Montana, and that'll take you to a website maintained by DPHHS.
Yeah. So we have a website, and on that website, a person could go. We have all of our contact information is there. There's a tab on the page that is called referral. They click on that. They click on the link to the referral page, and they can make the referral right there. And it's a secure website, so there aren't any issues about HIPAA violations. It does a little history of MFP. Again, it has, I think, my telephone number, email addresses for our staff. And that's pretty much the easiest way the place to start.
Yeah. And again, if folks are having trouble finding that, they're welcome to call us at Lyft, and we can point you in the right direction. And it may very well be that the referral gets it comes back to our auspices. But again, there are other programs involved as well. So again, and you can reach us at Lyft at 406-259-5181 or 406-948-8500. April, thank you for joining us today and telling us all about Money Follows the Person. It really is, and we recognize this in 2014 that this really is a game changer for people being able to live in what the Olmsted decision calls the least restrictive environment.
Exactly.
Thank you.
Thank you for having me.
This has been Living Well in Montana, a program of living independently for today and tomorrow. For more information about Lyft, please visit lift.org. Thank you and good day.